Hello, my dear students. I'm Dr. Vaishaly Bharambe. Over the last 5 to 8 months, I've been teaching you a lot of anatomy. Okay, every 3 times a week, I come up with a video. I teach you anatomy. But for many of these videos, while they've been very much appreciated, most of my students have said, ma'am, can we request you to teach us how to solve MCQs on these topics? Because I've realized that solving MCQs seems to be your target where your PG entrance exams are concerned, right? So with that point of view, I've started this new series, which is about solving MCQs, okay? So today we are going to run through MCQs of the inguinal region. This is part 3. There are already part 2 and 1 which are uploaded. They'll help you to solve comparatively different aspects of inguinal region MCQs. Let's begin. My method of taking you to solve MCQs is first quickly give you some anatomy and then help you solve related MCQs. So here in this case, you already know the names of a number of abdominal herniae. So there are often in the inguinal region, they will put up names of other abdominal herniae, Richter's hernia, Litter's hernia, and so on. So you have to quickly ask yourself, do you know these names? The names don't give you any idea of what they are. You know it, otherwise you don't. So let's start. Richter's hernia refers to. Now you must, before you look at the options, remember Richter's hernia is when a part of the circumference of intestine herniates out, not the entire intestine. Okay? This is the image. Can you see how the intestinal continuity is there? And then there is a part of the intestine herniating out. So with this knowledge, go and solve. See the options. Hernia contains intestines, yes. Strangulated hernia, not normally. Only part of the circumference of intestine is caught in hernial sac, yes. Only a part of the circumference of intestine is caught in hernial sac. I think this is yes. Hernia contains urinary bladder, no. So Richter's hernia refers to most correct option is point number C. I agree that hernia A contains intestine is also correct. Could be strangulated, but in this case, they have not mentioned that is strangulated. So most correct definition is likely to be point number C. Many times MCQs are like this. You have to look for the most correct option. Yes, it is C. Now, which of the following hernia is called Litter's hernia? Stop. Litter's hernia is equal to Meckel's diverticulum. This should happen automatically. So, what are the options? Hernia containing Meckel's diverticulum. Karo, yes. This is it. Everything else is there, but this is going to be the answer. Hernia contains bladder. Hernia contains sigmoid colon. Hernia contains ovary. No. Hernia contains Meckel's diverticulum. A has to be the answer. Option number MCQ 3. Which of the following would make you suspect a femoral hernia? What is femoral hernia? Students, femoral hernia is when a hernia comes out of the femoral canal, passing through, emerges out of the saphenous ring. Okay, now, so this is where is the pubic tubercle of the patient. Such a hernia is below and lateral to the pubic tubercle. A fullness immediately above the groin crease? No, below the groin crease, not above. A fullness in the scrotum? Femoral hernia never enters the scrotum. Swelling below and lateral to the pubic tubercle? Yes, this is likely to be the answer. A swelling above and medial to the pubic tubercle? Never. Femoral hernia is always, see, this is the pubic tubercle. Femoral hernia is always below and lateral to the pubic tubercle. C is the correct option. Yes. Following hernias are known for high chances of strangulation. Logic. When will a hernia get strangulated? When it is passing through a very narrow opening, which happens in case of femoral hernia. Remember, femoral hernia passes through femoral canal, okay, and emerges out of the saphenous opening. The opening is narrow, chances of strangulation are there. You're looking for an incorrect option. Obturator hernia emerges through obturator canal, which is again very narrow. So this is also possible to be strangulated. Spigelian hernia passes, it's a gap in the abdominal wall muscles lateral to the rectus abdominis. Again, the gap is narrow. Chances of strangulation are there. However, direct inguinal hernia descends through a very large space. It's just abdominal wall weakness basically. So, direct hernia rarely, if ever, gets strangulated. So, out of all these, D is least likely to be strangulated and therefore is the correct option. See, you can see it here. This is the direct inguinal hernia. There is a very large space through which it is getting herniated out. So, chances of strangulation are very less. MCQ 5 now says very interesting. Match the hernia to its anatomical site. This needs you to have knowledge, students. Morgagni's hernia, Spigelian hernia, Bokdalic hernia, Richter's hernia. You just have to match the columns, okay? So, we just did Richter's hernia, so let's solve that first. Richter's hernia, circumference, part of circumference of intestine is herniating out. Herniation of partial thickness of wall through hernial orifice, therefore Richter is 3. Okay? Bokdalic hernia, Morgagni hernia. These are both diaphragmatic hernias, remember. Bokdalic is when there is a hole in the diaphragm posteriorly, gap in the diaphragm posteriorly. Okay? Morgagni is when there is a gap in the diaphragm anteriorly. A parasternal herniation of intra-abdominal contents through the medial aspect, parasternal, anterior. So, Morgagni has to be 1. Bokdalic, herniation of intra-abdominal contents through the lateral aspect of diaphragm. Yes, 2 is Bokdalic. See, they are both diaphragmatic hernia. Spigelian or soft mass lateral to rectus abdominis muscle. Okay, so this is Spigelian. Now let's check our answers. A is 1, Spigelian is 4, C is 2 and Richter is 3. Perfect. Okay, so some knowledge, some logic. So here's your Morgagni hernia, remember parasternal and anterior. Here's your Bokdalic, lateral and posterior hernia. In these cases, abdominal contents herniate upwards, making it difficult for the patient to breathe. Sometimes they are congenital. In fact, they are a cause of congenital death of infant. Okay, intrauterine death. MCQ 6. If a hernia enters scrotum, it is most likely to be the following type of hernia. Direct rarely enters the scrotum, it's so big. Okay, indirect, yes, from deep, through canal, superficial and down, possible. Femoral is lying below, it cannot enter the scrotal sac. Umbilicus is lying too above to enter the scrotal sac. So according to me, indirect B is the option. Why not direct? It's too wide. The opening is too wide. The amount of herniation taking place cannot pass into the scrotum. Femoral, remember again, this is the pubic tubercle, that's the inguinal ligament. The femoral hernia always lies below and lateral to the pubic tubercle. It can, and somewhere here is the patient's scrotum. So there is no way the hernia is going to go into the scrotum. Okay, so you have to use some logic to come to answers. Let's see if my answer was correct. Yes, it was. So with this, we've covered some of the other names of other named hernias. Okay, embryology is something most of you are generally very reluctant to learn. So I'm going to take you through some basic embryology, okay, so that you can solve related MCQs. Remember, this has to be studied. For this, you have to understand development of male reproductive system, development of female reproductive system, and as well you must study the processus vaginalis and gubernaculum related developments. Okay, so MCQ 7, indirect inguinal hernia is a remnant of. Indirect inguinal hernia is a remnant of. How to remember? Who knows? We never did. तब भी embryology नहीं किया, madam. Okay, I'll teach you. So what you're seeing here is the development of the young infant you can see that the testis is lying high up here. This is the gubernaculum, okay, and now the testes has started to descend. Can you see how the gubernaculum is literally pulling the testes down into the developing scrotal sac? As it descends down, you can see a processus vaginalis or a process of peritoneum descending downwards along with it. Here you are seeing finally the testes has entered into the scrotum. Here you can see the gubernaculum has formed the scrotal ligament, and you can see that the processus has got obliterated, leaving only the tunica vaginalis sac here. Okay, and this is this normal male development. But if the processus vaginalis never got obliterated, okay, can you see its continuity with the abdominal wall here? Okay, so this results in indirect inguinal hernia. Again, what else to remember? Gubernaculum in male produces scrotal ligament. So, go back. Indirect inguinal hernia is a remnant of. Now, you already know it's a remnant of processus vaginalis. D has to be the answer. Can it be gubernaculum? No. Gubernaculum remains as scrotal ligament. Mesonephric duct results in male reproductive organs. Paramesonephric duct results in female reproductive organs. So, both do not result in indirect inguinal hernia. So, D is the correct option. MCQ 8. The following conditions results from unfused processus vaginalis. Now, remember, processus vaginalis is communicating abdominal cavity with the scrotal sac or labium majus. If it is partly obliterated till the superficial inguinal ring, the condition is called bubonocele. If it is very little obliterated just above the apex of the testes, you call it congenital funicular hernia. And if it is not obliterated at all, completely in continuity with the abdominal cavity, you call it a complete inguinal hernia. So, following conditions result from unfused processus vaginalis bubonocele? Yes, we are looking for except, okay, we are looking for the negative answer. So, bubonocele, yes. Complete inguinal hernia, yes. Congenital funicular hernia, yes. Direct inguinal hernia? No. Direct inguinal hernia results because of old age, weakened abdominal wall muscles. It is not because of unfused processus vaginalis. So, B has to be the correct answer. Let's take a look. Yes, it is. Let's move on to MCQ 9. Canal of Nuck is a remnant of. See, in the female, like in the male, there is a processus vaginalis which results in tunica vaginalis. In the female, the same processus vaginalis can remain behind in the form of a thin canal called canal of Nuck. Okay, so take a look. Can you see that here is the gubernaculum in the female here, and this is also the gubernaculum. Okay, the posterior part of it, which is going towards the ovary, results in development of round ligament of ovary. This one results in development of round ligament of uterus. And as it descends down, it carries a small pouch of peritoneum with it, which is called as canal of Nuck, which is seen in a few females. This canal is a potential site of indirect inguinal hernia because it's a pouch of peritoneum. Herniation can take place. Okay, so let's go back to our question. Canal of Nuck is a remnant of, it's a remnant of processus vaginalis. Just like in the male there was herniation, similarly in the female also herniation can take place. Is it a remnant of gubernaculum? No. Who is a remnant of gubernaculum? Round ligament of uterus and round ligament of ovary. Is it a remnant of mesonephric duct? No. Is it a remnant of paramesonephric duct? No. It's a remnant of processus vaginalis. D is the correct option. MCQ 10. A doctor diagnosed a newborn baby of having right-sided cryptorchidism. What is cryptorchidism? Undescended testes. The testes may be trapped in any site. Remember, testes descended from abdominal cavity. So, it can get stuck at deep inguinal ring? Yes. It can get stuck outside superficial inguinal ring? Yes. Can it get stuck at pelvic brim? Yes. Can it just get stuck in perineum? Not likely. It would go into the perineum. Okay. The child has cryptorchidism, undescended testes. Somewhere in inguinal canal? Yes. So the only site where you will not find this child's testes is in the perineum. Okay. Anywhere along the Vaishaly, you have to think of it like this. It is descending down, so it can be stuck at deep inguinal ring. It can be stuck inside the inguinal canal. It can be stuck at the superficial inguinal ring. Okay. And it can be stuck at the pelvic brim, which is actually somewhere close to superficial inguinal ring. So it can be found anywhere. But it will not be found in perineum because it is undescended testes or cryptorchidism. It has not descended into the perineum. Okay. Right. So let's see what the option answer is. Answer is D, perineum. It will not be found in the perineum. MCQ 11. Gubernaculum develops into all the following except. In the male it forms scrotal ligament. Yes. Okay. In the female it forms round ligament of uterus. Yes. It forms round ligament of ovary. Yes. Does it form tunica vaginalis? We are looking for except. So does it form tunica vaginalis? No. Who forms tunica vaginalis? The processus vaginalis forms tunica vaginalis, not the gubernaculum. So revise quickly. Gubernaculum in the males forms scrotal ligament. In the females forms round ligament of ovary or round ligament of uterus. It does not form tunica vaginalis, which is formed by processus vaginalis. Processus vaginalis in the females forms canal of Nug. So B is the incorrect option, or which is the answer in this case. MCQ, needing complete overall knowledge of inguinal region and hernia. We've done quite a bit now. Let's see if we put it all together, are we able to solve some different kind of MCQs. While examining a case of direct inguinal hernia, following will be true except. You're looking at a direct inguinal hernia, so it will be on the medial side of inferior epigastric artery. It will not be through the deep inguinal ring. Inferior epigastric artery will lie lateral to the hernial sac. Yes, true. We're looking at except, okay? We're looking for the wrong thing about direct inguinal hernia. Patient is likely to be elderly, yes. Hernial sac will emerge out of the femoral ring. Absolutely not. The hernial sac will lie above the inguinal ligament, yes. So while examining a case of direct inguinal hernia, following will be true except. What will not be true? That the hernial sac will emerge through femoral ring. It will not be true. All the others are correct. MCQ 13. Following pairs are correct except. Okay. So direct inguinal hernia, inguinal triangle. Start to imagine now. In direct inguinal hernia can be found in the inguinal triangle? Yes. Indirect inguinal hernia, medial inguinal fossa. I am not sure about this. Okay. Cremastric muscle, genital branch of genitofemoral nerve, correct. Conjoint tendon, ilioinguinal nerve, correct. So, indirect inguinal hernia should have been lateral inguinal fossa. It is not present. Indirect inguinal hernia is not formed through medial inguinal fossa. So, B is an incorrect option. Okay. Therefore, B has to be the answer. Yes. So, students, we've solved a number of MCQs. Okay. More of these MCQs can be found if you visit my website at vbanatomy.com, where you will get a lot more about, and you will be able to solve many MCQs. Okay, it does not I don't charge you for any of these. Just go ahead and solve those MCQs and develop your MCQ solving skills. The link for the website also is given in the description section. I've already taken 2 videos on MCQs of inguinal region, part 1 and part 2. To have complete confidence in solving MCQs, do see those as well. If you want to study the anatomy of inguinal region, I strongly suggest that you see all the videos. In the month of February and March, we at VB Anatomy have been just doing the inguinal region. So, Anatomy of Inguinal Canal Part 1, 2, Anatomy of Indirect Inguinal Hernia, Anatomy of Direct Inguinal Hernia, how to draw inguinal hernia, all these have been covered over the last 3 weeks. Enjoy yourself, students. Learn, understand, recall. Thank you. Keep studying. I'll see you across the screen in some other video. Bye.